Okay, guys, so now it's going to be part 2 of colic, and we're going to talk about medical management and then surgical types of colic, okay? Okay. So it's the switching gears from gastric ulcers to colic. So what is colic? So the term colic actually means abdominal pain, okay? Now, in the abdomen, if you guys remember the abdominal cavity, has multiple organs. So it's not just GI tract kind of pain. So all problems that we have in many different organs in the abdominal cavity may come out as signs of colic, okay? Obviously, the largest organ that we have there is the GI tract. The pregnant uterus is also very large. But then we have liver, we have pancreas, we have the kidneys, we have the reproduction. Come here, Kitty. We have the reproductive tract. So there are other organs. We have vessels that go in there. We have areas of the diaphragm. We have, or the side of the abdominal cavity. Hold on, my cat is making an entrance. There we go. Hi, hi. This one here is Jolene, like Dolly Parton's Jolene. Hi, say hi. Hi, hi. And so we just need to understand that colic doesn't necessarily mean GI tract problem. So that's why I put here GI, non-GI, okay? Clinical signs of, oh, come back. Oh. Clinical signs of colic, we're gonna have clinical signs that can go from mild colic to severe, moderate to severe colic, okay? So we're gonna start with inaptitude, like, I don't really feel like eating, to anorexia, like, oh my gosh, I cannot eat 1 meal in my life ever again, okay? So one way to do this is like, the horse is being a little bit, doesn't want to eat his hay, but you offer him a peppermint and he takes it, okay? So that's inaptitude. Doesn't have a huge appetite, but you offer something enticing and he wants it, okay? So then these are mild signs. Pawing, looking at the sides and flanks. They just look, they don't know what's going on. Biting at the sides and flanks, frequently up and down. So it's the horse that just uncomfortable. Recumbency, so it's the horse that is just laying down. He can be sweating. He can park out with his forefeet like in a sawhorse kind of stance, with his, to try to open up the abdomen, to try to give more space for what's being, so things feel a little tight in there, okay? And then moderate to severe colic, we're gonna have anorexia, to like a horse that is very listless, or he can actually be the opposite, agitation and restlessness. He won't stop, he's just like, doesn't feel good. A lot of the times we have very distended abdomen. You look and you're like, oh my gosh, this is because it's so inflamed. There's swelling happening. Instead of just recumbency, this horse is going to be rolling, thrashing. This becomes a little bit more severe, and it also becomes a little bit more dangerous for the person handling this colic, because if the horse is thrashing and just throwing himself against things and he is not in his stall, he can actually fall on top of you. Self-inflicted trauma and sweating, okay? So what causes GI pain? There is different things that are going to cause, but generally it's the tension. When things are inflamed, they have a tension, and that is what causes the pain. Hold on just a second. I have to stop for 1 second. Sorry, my chicken nuggets go already. So, okay. So tension on the mesentery. So the mesentery is, so the GI tract, so the intestines are in loops, right? So they are, oh, come back. They are loops, okay. And loops of the intestinal tract. And then this is all connected. So it's not just like loops that just loop around with no beginning and no end. This is not how it goes. They are all connected with this fabric, almost, that's called the mesentery, okay? And the mesentery also has veins and arteries, and that's how, and this goes like this. I wish I knew how to do different colors for my pen. Let me see. Yeah, I don't know. So the mesentery, when this guy here is inflamed and swollen, it puts tension on the mesentery. So this is something that is interesting. A lot of the organs, they don't have pain receptors or neurons that cause pain when they are just, when you cut them, they're just like, they don't feel any pain. When they feel pain is because there is generally a pellicule, like a, how can I say, like an involvement around them, a little mucosa, it's actually serosa around them. And when the organ is inflamed and it swells up, it puts tension in that serosa that is around them. And that's generally where, so the organ itself doesn't have pain sensories, but the little fabric that goes around them, the serosa, that has a lot of pain sensory. So when the organ gets distended because it's inflamed and swollen, it puts tension in that, and that's what causes pain. That can go from liver, for pancreas, etc. Okay, so tension on the mesentery is going to cause pain. Distended bowel. So the distended bowel. So tension in the mesentery can happen for different things. So the GI tract is distended, it causes tension, or it's torsion, there's torsion, it causes tension on the mesentery. Things are displaced, it causes tension in the mesentery. Distended bowel. So this, the bowel itself is inflamed, okay, and that creates pain in there. Bowel ischemia or infarction. So ischemia is this. So if this loop loops around itself, okay, and creates like a torsion, a knot, that leads to ischemia. What is ischemia, guys? A block in blood flow in that area. When there is ischemia in that area, this area here starts to die. And when areas start to die, guess what? The pain is relentless, okay? There is a lot of pain. Smooth muscle spasm. Everybody here has taken laxatives. And when we take laxatives that cause a smooth muscle to spasm, what are they called? They have a name for them. I'm going to find out. But when these spasms happen, we have what? So we've had diarrhea also in our lives, sick with the GI tract kind of viruses. When the smooth muscle is super, super fast, there's a lot of spasm contraction, we feel that pain. You guys have felt that in your lives. Adhesions. Adhesion is this. Sometimes due to trauma or previous surgery, things, instead of healing perfectly, they get adhered. So they get connected, glued to the wall or to itself, okay? So glued to the wall, or there is here, and then say they looped around and then they glued to themselves. So anytime that there is some sort of like a bigger amount of food passing here, as it should be, it creates a little tension because there's that adhesion, and then it causes pain. So adhesion, if anybody here that has had any kind of surgery before and the area doesn't heal really well, so in inside organs or even outside, there is adhesion. So things get glued together because of the inflammation that is caused. The fibrotic tissue all glues things together. And that area, if anybody has had surgery in their lives, they may feel pain in the area because there is adhesions happening there, okay? And then peritonitis. Peritonitis is the infection of the peritoneal cavity. How can that happen? So infection of the peritoneal cavity can happen because of small leakage. So the amount of bacteria that we have in the GI tract. So if there's a little hole here caused by trauma, caused by ulceration, and there is leakage of the, I don't understand why it does this little thing here, of the intestinal material into the abdominal cavity, the peritoneum is actually, I'm going to draw a horse here. Thoracic cavity, abdominal cavity. The peritoneum is the lining of mucosa that lines the inside of the abdominal wall. So peritonitis means that there is infection inside the abdominal cavity. And there's different ways to figure that out if it's happening or not. But one of the ways that it can happen is leakage from the stomach. If there is gastric ulcers that is perforated and it slowly leaks into the peritoneal cavity, etc. Okay, that has a lot of bacteria in it and causes infection. Okay, general risk factors. So anatomy obviously is the first one. We're going to see the anatomy here in a second, but a lot of the times horses areas go from bigger to smaller. So there's lots of areas that impaction can happen. Management practices, we talked about this. When horses are high strung, if they feel stressed, if they feel if they're the lowest in the pecking order, there is research that shows that higher strung horses have a higher prevalence of having colic because they just have spasmodic type of colic. So they're wired different. They're wired to be reactive, so everything reacts in them. And then management practices, if you feed coarse hay, you can have impaction. Depending on where you live, you can have sand colic, so etc. Okay, and the stress, gastric ulcer, etc. Weather here in Kentucky changes every day. We can go from a 60-degree weather to a 20-degree weather, like in the period of 12 hours. And we all know that there's multiple things. So when it goes from being warm to too cold, in the cold, horses don't drink a lot of water, okay? So when they don't drink a lot of water, which helps wet and moisten the content, it can create impaction, okay? So coarse food with not drinking a lot of water, that ingesta inside the GI tract can cause impactions, okay? The other thing about weather, if it's super hot and summer and the horses are uncomfortable, they also don't drink water, they're sweating and they are becoming dehydrated. And dehydrated horses can also lead to impactions, okay? As a matter of fact, the treatment for impactions is to rehydrate the horse very, very aggressively. Diet and nutrition, coarse hay or too much feed, little forage, no turnout, etc. Horses that cribbing is not only destructive. I don't like a horse that cribs. It's not only destructive, but horses that crib can, first you need to figure out why the horse is cribbing, okay? Is this something that he developed as a foal? Because a lot of horses start to crib as foals when they start to, when they get weaned, because it's very stressful, or when they start to feed a little bit of the mare's food and they start to eat a little bit, and that can create gastric ulcers and they can start to crib there to try to cope with the pain. But cribbing will lead to one type of colic, which every time the horse cribs, it diminishes the pressure inside the abdominal cavity. It goes, it sucks in the air. And that can lead to colic by epiploic entrapment, which we're going to talk here in a second, okay? Pregnancy. So pregnancy not only, so things are getting so big inside the uterus that it shoves things away, and that can lead to colic, number one. Number two, hormones that are in pregnancy can also lead to upset stomach, upset GI tract. And number three, when the mare foals, that huge area that used to be where the uterus was, all of a sudden becomes this void because the foal left. And sometimes the GI tract, if she's having a little bit of spasms, can actually roll around itself and create problems, okay? So there is a huge chance of mares colicking after they foal. And we already talked about NSAIDs when it leads to gastric ulceration, but also NSAIDs can lead, if you guys go back to your anti-inflammatory lecture, NSAIDs can also lead to renal failure, okay? So when kidneys start to fail, you can also see signs of colic. Just a second. Okay, guys. So I say here, lots of things can happen, right? So to remember the anatomy of the GI tract, I was saying how there are some parts that go from larger to smaller, and impactions and lots of problems can happen. First of all, entire GI tract of a horse is very, very long. So there's many, many areas that can actually go wrong. And just so you guys can understand a little bit, so this is the mesentery right here, this tissue that happens right there. So here's the thing. We need to just remember a little bit of the anatomy. So we're going to have the esophagus, stomach. We are going to have the duodenum, jejunum, and ileum, okay? Then the ileum is going to go to the cecum. The cecum is the same as our appendix. The cecum, the ileocecal valve, so the valve that joins the ileum to the cecum is a valve, okay? So it allows for the movement for the ingesta to actually drop to the cecum as the cecum needs more, okay? And you guys need to remember that enzymatic digestion happens in the small intestine, and then starting in the cecum, we have fermentation. So bacteria, protozoa, etc. Microbial fermentation is going to happen to continue to digest fiber, etc. Okay? So then, hold on just a second. So we're going to have the right, from the cecum. And here, I don't know, this is obviously spread around, okay? So from the cecum, because this, if you need to imagine, everything's inside the abdominal cavity, okay? So obviously this is all truncated and on top of each other. But from the cecum, we're gonna have the right ventral colon. So ventral because it's lower in the abdomen, as a ventral and dorsal, okay, if you guys remember from anatomy. Then we're going to have the sternoflexure. Flexure, it's a turnaround, so the sternoflexure, the left ventral colon, I forgot the name of this one. Hold on just a second. Oh, I need to remember this. Left ventral colon. Oh gosh. The pelvic flexure. How did I forget this? The pelvic flexure. And then we're going to have the left dorsal colon, the diaphragmatic flexure, okay? And then we are going to have the other parts of the colon that are going to be further divided as transverse, etc. And then we're going to have the rectum. So there's different anatomic books that call it different things, and that's why. So we have here the dorsal colon, okay, so the diaphragmatic flexure, the dorsal colon, and then we're gonna have the small colon. Other books are gonna call the transverse colon, and then the rectum, and then the anus, okay? So the reason for this particular graph is the fact that you need to see that food, number one, this is all loose, okay, many, many feet long. And then there is like a door here that opens and shuts. And there is a particular species of tapeworms that like to attach to that area. So if you have a lot of those worms there, they're going to just close the ileocecal valve, and they are going to cause impaction from that area and then back. And then what I want you guys to understand is that there is so many different turns that are, if you guys can see this, I don't know that you can, these are attached, okay? So the colon is not totally loose like the small intestine. So they are attached and they cannot move around. But as you can see, this little area here is fairly loose, okay? So this is the left type side of the colon, and it can actually flip around. As it flips around, and we're going to talk about here, this is a type of dislocation that we can actually the veterinarian can try to pull with their hands, and maybe doesn't need surgery. But there are other types of dislocations that the veterinarian is going to have to do surgery on the horse. Here's the thing. I keep looking up there. It's because my cat, I have 6 of them, but I have 2 that live inside the house, and I'm trying to train them to go outside the house, and one has herpes virus right now, so she is not feeling too good, okay? We already talked about this, guys. The non-GI causes of colic. So remember, colic is abdominal pain, and a lot of other organs can actually have signs of colic. So you don't know. We assume a lot of the times that it is the GI tract because it's the largest organ inside the abdominal cavity, but there are other things that can cause colic also. Okay, we already talked about this. Laminitis. Colic can lead to laminitis, and laminitis can lead to abdominal pain. So this is something just for you guys to think about. Pneumonia, especially pleural pneumonia. It's in the thoracic cavity, not even in the abdominal cavity. It's in the thoracic cavity, but it presses down and it can cause signs of colic, okay? Different things. So cancer, foes can rupture their bladders, and that can lead to signs of colic as well. So here's the thing. So GI causes of colic, so those that are in the GI tract, and we're going to divide them between medical and surgical. And here's one of the things for you guys to understand. Obviously, surgical is something that cannot be corrected medically, but also mainly is the fact that if medical treatment fails, that may mean that it's a surgical type of colic, okay? So we try first to see, because a lot of colics, you need to open up the abdomen to see what's going on, okay? So we're gonna talk about medical and surgical types of colic. So primary tympanic colic, so that's gas built up. That happens all the time because, especially like in the spring when new grasses are coming in and horses are eating all this grass is full of sugars, and they create a lot of bacteria. And as you can see, as you know, bacteria form a lot of gas, and they can create the primary tympanic colic. So a lot of the times the horse is uncomfortable, but you give some Benamine and walk the horse a little bit, and then the horse gets better. Spasmodic colic, that's colic where the GI tract is just contracting a little bit too much, okay? This colic is semi-common. It is theorized that a lot of colics happen in the field, and we don't even know because they get resolved by themselves. So there may be a horse colicking right now with a little discomfort, and then it resolves by itself, okay? Impactions and sand. Impactions, like I said, you need to rehydrate this horse a lot. Sand, you need to be able to eliminate that sand. A lot of diarrhea, so proximal enteritis. So the inflammation is going to need to be treated medically. It may hurt the horse, but it's Benamine that we're going to be used. Most left dorsal displacements, which is exactly what I showed you guys. Oh, come back. No. What I showed you guys here. This is left displacements, okay? Dorsal meaning that it's going to go up. So here's the thing. Let me draw. I'm going to draw here, okay? So this is the cutout of the abdominal cavity of the horse. We are going to have, there's a kidney. There is the left kidney, right, left. And there is the spleen right here. And there is a ligament that connects both of them, okay, a little tissue that connects both of them. And then you have the loops of the intestinal tract all connected. And the left dorsal displacement is that area that I talked about, that it folds on itself and gets entrapped inside this area here. That's called the nephrosplenic region, okay, because it's a little area that creates a little empty area that column loop can actually go inside because of that ligament, the nephrosplenic ligament. And then once it gets in there, as you guys can imagine, it becomes inflamed and it can swell up. As it swells up, it becomes a little difficult to pull it back out. But if you can get it kind of soon, you can actually pull it out very gently. Obviously, something for the veterinarian to do etc. Some right dorsal displacements can actually be treated medically, and obviously ulcers are treated medically. Surgical cases of colic, enterolithiasis, that is when the animal eats something. Those are called like the black pearl. When the animal eats something and then there is accumulation of metals, not metal like such as like nails and stuff, but there is just accumulation of all this ions and etc. forming this ball. Okay, and this ball of protein and calcium, calcification, and generally a lot. Enterolithiasis, I'm talking about calcium because if you feed your horse only alfalfa hay, there is a more chance for the horse to develop this because all this calcium can become all together, all bound up. But if the horse eats alfalfa and also grass, he is not at a higher chance of developing that. So this particular ball, it can move around, and if it moves around and it blocks or it goes to one of those flexures or one of the valves, it can block the valve and produce impaction every place else. The difference between this and the impaction that is caused by horse hay or the horse not drinking a ton of water is that rehydrating the horse is going to take care of this guy. But this type of impaction here, because that area is blocked, there is nothing that can be done other than opening up the horse and I said metals, but I meant minerals. You can need to open up the horse and remove that ball around, okay? Pedunculated lipomas. So that lipoma is fatty tumor. It happens in horses that have been fat. It happens in ponies. It happens in older horses. So pedunculated, so that means that it has a pedunculum, which means that it's a ball and a chain kind of effect, okay? So we have this fatty tumor that is connected to like a little string, and sometimes this loops around the intestinal loops and it creates strangulation, okay? Intestinal volvulus is when the intestine turns on itself. Intussusceptions is when the intestine loop telescopes itself. Hernias, a hernia, the definition of hernia is when this part of this organ is in a cavity that it should not be, okay? So there's many different types of hernias. There's scrotum hernias is when the intestinal loop goes into, or inguinal hernias is when the intestinal loop goes where the scrotum is supposed to go, the testis is supposed to go, and loops around that inguinal canal and inflames and swells and then cannot be removed from there, and then you have to remove it. Umbilical hernias is when the intestinal loop goes in the umbilical little hole that there is and causes, also inflames and needs to be corrected surgically. Some accidents, so when horses, when dogs get hit and some sort of trauma, there can be a cut or a rupture in the diaphragm, and a loop of the intestine can actually move from the abdominal cavity and go to the thoracic cavity, and that's the definition of a hernia because it's outside of the place that it should be. It's an organ that it's outside of its own cavity going to someplace else, okay? So that needs to be corrected because you need to close up the hole. Mesenteric rents. Mesenteric rents is, if you guys remember the mesentery, sometimes there's holes in the mesentery and sometimes intestinal loops go inside that hole, and you have to open up the horse, remove the loop and close that hole. Epipleutic entrapment is what I talked about when horses that crib can also have. It happens in the specific hole inside the abdominal cavity where the intestinal loop goes inside as well. Let me try to move myself from here. So this, I'm just going to show some pictures and explain just a little bit about the different types of colic. So this is tympanic colic. Obviously, this has been operated on. Most of the tympanic colics are not operated on. Sometimes you can put like a thick needle on the cecum of the horse from the right flank of the horse. You can put the needle there, and it's a thick needle, and then you are going to release all that gas, okay? But it's gas distension, and a horse that's gassy, you're gonna hear the horse passing a lot of gas. We're gonna have abdominal distension. You're gonna see the abdomen of the horse is really distended, passage of large amounts of gas. The primary tympany can happen due to microbial fermentation, like I said, of lush pasture, grain, or any type of change of grain that you may do. And then there can also be secondary tympany when there is obstruction somewhere in the colon, and then bacteria start to build up on this area here and start to multiply, forming gas. But in that particular case, you need to figure out the obstruction. Spasmodic colic, we already talked about a little bit, when there is hypermotility of the intestinal tract, and that causes pain. And we already talked about this. There's going to be bouts of sharp pain. For some reason, horses that are high strung are more predisposed to this. Nobody knows why. This type of colic comes and goes. Sometimes you treat with Benamine, sometimes with Dipyrone, and it just goes away. And this is the type of colic that I said horses may be having right now, and we don't even know, because it just comes and goes. And treatment may be Benamine, maybe Dipyrone, but it may resolve by itself also. So like I said here, responsive to Benamine. Spontaneous recovery, very likely. Okay, it's a very common cause for colic. No one actually knows what causes that, but we think that maybe these high-strung horses may have a nervous system that is wired a little differently, and may predispose them to this colic. Impactions, we already talked about this a lot, but when we have too much of dry or indigestible feed, and then it just creates that dry, coarse impaction there. And the treatment for that, obviously, you're going to give Benamine to the horse, and you are going to give a lot of fluid, hyperhydrate this horse to try to hydrate that mass of dry hay inside the horse's GI tract. Poor dentition is one of the causes, because the horse is not masticating well, so he is ingesting and swallowing poorly masticated pieces of hay. Dehydration, we already talked about this, a lot of the times if you see dry mucus covered fecal balls, that's a sign that the horse is dehydrated. Okay, so we need to make sure to take care of the horse and figure out why he's dehydrated. Maybe he does. I had a horse here in my farm, and she's still here. She didn't like to drink water from her buckets in her stall, and we put buckets because I want to know how much water horses are drinking at night. Outside they have automatic water, so there's no way for us to know how much water each horse is drinking. But what happened is she drank fine outside, but in her stall she didn't like to drink. And then I was just like, I'm gonna buy a yellow bucket for her, because my automatic water outside is yellow. And I'll tell you what, because my buckets are all blue, and I bought the yellow bucket for this horse, and she started to drink in her stall. So this is when I'm telling you about management. You need to be creative. You need to realize and think about. I know it's weird. I had never had a horse that responded to collar like that. I've never had a horse since her. She's still here. She's an older animal. But just so you know how to, even things that, oh, I've never had a horse with this. It doesn't matter. This is a horse that needs that. So you need to just be creative and figure out things to do. So that leads to reduced water intake. Meconium, so that's the first pieces of the foal. They can actually cause impaction in the foals, okay? Left dorsal displacement, so like the nephrosplenic entrapment, we have that space. I already explained what that is and how that colon can become trapped in that area, and most of the times it's resolved medically. There's medication that you can give to try to shrink the blood vessels, and then as it shrinks, you can actually try to pull it out. Warm bloods and large thoroughbreds are more prone just because the space is much bigger there. So then the colon can easily loop into that space. And one way to diagnose this particular disease, as you are palpating the horse, you are trying to feel, so you can easily feel the left kidney of the horse. In the case of a horse that has this type of displacement, you can't touch the kidney and you can feel that that area is problematic. And with ultrasound, you cannot visualize the left kidney because there is obviously colon in there. So how do we manage these colics what do we give to these horses that are having bouts of colic? So first of all, we're going to give analgesia to these horses, okay? So non-steroidal anti-inflammatory drugs, the drug of choice is Benamine, okay? Benamine, it's important that if you own horses and you don't know how to give Benamine IV, you have to learn, because you can only give so much Benamine a day, okay? And it is 12 mLs max, for example, 10 to 12 mLs max. Maybe if the horse is not responding, you can give a little bit more. But the truth is this: if your horse has colic and you're going to give Benamine, one of the signs to figure out if this horse is going to continue is responding to treatment and may or may not go to surgery. One of the signs is how he responds to treatment. And response to treatment is by the IV administration of Benamine, which it may take 20 to 30 minutes for all these signs, the clinical signs of the horse of pain, to start to become normal in the horse and to see that the horse is responding to treatment. If the horse is not responding to treatment after 20, 30 minutes of giving Benamine, it may mean that the horse needs to go to colic. Now, a lot of owners will give Benamine oral. And for any medication to be active orally, it means an hour to 2 hours. So now you gave Benamine oral, you call the veterinarian, the veterinarian arrives there, and you've given this 30 minutes ago. There's no way to know if he's improving or not, because it may take 2 hours for the horse to improve, but you have effectively prohibited the veterinarian to give an IV dose of Benamine to actually start to see if the horse is going to respond to treatment or not. So if you have a horse and don't know how to give Benamine IV, you need to learn. Okay, that's important. Xylazine, also another drug of choice. Xylazine is going to cause analgesia and is also going to sedate the horse a little bit, okay? So that's for horses that are thrashing, for horses that are uncomfortable and they are just moving around. It's important that they get a little, if they're not responding well to Benamine, that they get sedated a little bit. Decompression via nasogastric tube. We have to, hold on just a second. I need to answer this, guys. Hold on. Hello. Okay, sorry guys. My son is going to therapy and there was his therapist office trying to schedule the next appointment. So let's see, where are we? Okay. So decompression via nasogastric tube. So you guys have been sick and you have, here's the thing, horses cannot vomit. So a lot of things that build up, we can actually vomit. Dogs vomit, and that particular thing that's making us sick, we can actually eliminate via throwing up, okay? But horses can do that. So one of the things that we can help these horses is to put a nasogastric tube, so a tube that goes from the nose of the horse all the way to the stomach of the horse, and to decompress, to try to remove all this liquid that is built up in the stomach. And that's one of the things also for us to see if the horse is a surgical candidate or not, because if the horse continues to have a reflux in the stomach, continues to have liquid built up in the stomach, that may mean that the medical treatment may not be working, okay? Fluid therapy, oral and IV, so it depends if the horse, how well the state of the horse is for you to choose oral or IV. But electrolyte solution can be given orally to try to make this horse try to drink water. A lot of the times you add salt and electrolytes to these horses, and instead of these horses drinking more water, they actually become more and more dehydrated. So it just needs to be something to be decided by the owner knows, or as a manager, you should know if the horse is going to drink water or not. Mineral oil can help to lubricate. So you can need to like put a nasogastric tube and pump mineral oil inside to lubricate that impaction. Important, very important. I need you to write this down, okay? Mineral oil cannot be syringed into the mouth of the horse, because mineral oil coats the larynx and pharynx of the horse and prevents the horse from coughing, okay? Because it's coated, that area is coated. So what can happen is you're putting mineral oil into the horse's mouth and it's coating that area, and some oil can actually go to the lungs of the horse and prevent him from actually coughing that out, which can then give the horse pneumonia, okay? And that is a problem. So mineral oil needs to be given by the vet via nasogastric tube. Epsom salts, because it draws liquid into the GI tract. So as you are rehydrating this horse, you can give some Epsom salts to try to draw more water to there to try to rehydrate the mass of impaction. And then psyllium is to try to eliminate sand. Other medical management, so Buscopan, that slows down the peristalsis. So horses with spasmodic colic, the peristalsis is just going a little bit too fast, and you give Buscopan and that slows it down, okay? Antibiotics, if the horse has enteritis and you're going to need antibiotics, maybe if the horse is too sick, always needing to prevent laminitis. Okay, there's different ways to prevent laminitis. One of them is to put different shoes on these horses, because like I said, horses that colic, they are very prone to developing laminitis again. We're going, if this horse is suffering from colic like right now, he should not be, you can offer him food to see if he's going to be, if he's anorexic or just inappetent, but you're going to have to do, depending on the reason for the colic, to do dietary modifications, okay? So is the horse, if the horse has bad teeth, what kind of hay you're feeding. There is a type of hay that's called coastal Bermuda hay. Coastal Bermuda hay is very thin and very stringy, so forming these long strings that can just ball up. And this is generally like in Florida, in Georgia, in the Carolinas, and that is a hay that actually leads to colic, okay, by impaction. So it's something to think about. Dietary modification means change the hay that you're giving this horse. If it's too coarse, etc. If this horse, the colic, the original reason for colic was worms, you need to deworm the horse. Obviously, if the cause for colic is because of poor dentition and because this horse is not being able to chew the food very well, so then he needs dentistry as well. Cardinal signs. This is important, guys. I need you to put a star beside this guy here, okay? Cardinal signs for going to surgery. It means what? You've been trying to treat this colic medically, but it's not working, okay? So how do we know this is the time that a colic needs to go to surgery, okay? Severe abdominal pain that is refractory to analgesic. So you're giving Benamine, xylazine, and nothing is working, okay? The pain is severe. So that probably means that there is some sort of strangulation happening, okay? Abnormal peritoneal fluid. So here's the belly of the horse, okay? And we go, and this is not working well, you're trying to treat medically, and you get a little needle, and I hate when this does this, and you perforate a little bit of the abdominal wall in the lowest part, to try to collect peritoneal fluid. It's generally like transparent, yellowish in color, like wheat kind of color. And if it's hemorrhagic, if it's discolored, if it has green in it, that means that there's some sort of something ruptured inside the abdominal cavity. You can also test that peritoneal fluid to see if it's abnormal. When you do a rectal examination by palpation, if the things are all distorted and twisted inside, so abnormal, distended, displaced bowel on rectal examination, this is important here. Progressive deterioration of cardiovascular status. So horses, clinical signs of horses in pain with colic is increased heart rate. If after Benamine, so a horse normal heart rate is 35 to like 45. Okay, the basal heart rate at rest, and you're auscultating this horse and his heart rate is 60, and then so that is not good, that's bad, and you give Benamine, and slowly within 20 to 30 minutes the heart rate should start to diminish because his pain is decreasing. Okay, now if the heart rate doesn't diminish, if his gums, you check the gums, they're white or they're brick red, and it continues to get worse, you test the capillary refill time and it's higher than 2 seconds, and it continues to not improve, that is a cardinal sign that the horse needs surgery. Okay, significant gastric reflux, already talked about that. Recurrent abdominal pain with unknown etiology. A horse that has colic all the time and you don't know why. Okay, so sometimes you just need to open him up to see what's going on. This is important. Star right beside this. Better go to surgery earlier than later. Okay, so, and this is one of the things that I always tell my students is, when is the decision to be made if the horse is going to surgery or not, if that horse is a surgical candidate or not. And the decision, what I say, needs to be made today. Okay, because when everybody is hysterical, the horse is not getting better, you're sad, you're crying, and the veterinarian is there, everybody makes the decision to take the horse to surgery, and knowing, and you may not know, but a colic surgery may cost $10,000 to $12,000. And now, how are you going to pay the vet? It may not even work. The horse is 25 years old. So the best time to make a decision to say, my horse, if he colics, is going to go to surgery is now. Okay, so at that time, before it gets too bad, you can actually say, you know what, let's take him to open him up to see what's going on. Now, depending, so I have a colleague that took this horse to surgery, and the horse was 34 years old. So I personally would never recommend a 34-year-old horse to go to surgery. The horse looked beautiful and was healthy otherwise, but obviously the horse never recuperated from surgery and had to be euthanized 2 weeks after that. Okay, so something to think about. In my personal opinion, if you have like horses, they have insurance, so it's something to consider. And there is ages. For example, in my opinion, I think like if my horses are 22 and above, they're probably not going to get surgery. If they need surgery for colic, they're just going to be humanely euthanized. Okay. So surgical cases for colic. Strangulation is one of them. So it's when the vascular supply is cut off. So you have loops of intestine strangulated. Okay, there's torsion happening. And there is going to be ischemia and necrosis to the region. So arteries are going to cease to pump blood in. The venous return is going to be stopped. Loss of swelling happening in the area. This is a biggie right here. Loss of mucosal barrier integrity. We talked about this before, but now everything is so necrosated that the bacteria can actually gain entry to the blood circulation. Okay, so bacteria and endotoxins can move across the compromised intestinal wall into the bloodstream. Loss of fluids and electrolytes. There's going to be dehydration. Oh my goodness. Dehydration. Cardiovascular compromise. The horse is going to may be in endotoxic shock. So it's something that This horse is here to correct the dehydration status of the horse. The amount of fluid we need to give back to this horse is incredible. A horse has more or less 40 to 50 liters of blood. And when he is dehydrated, a very severe dehydration is something like 10% of dehydration, okay? 10% of dehydration on a horse that weighs 400 to 500 kilo means 40 to 50 liters of fluid back in. So this blood here starts to become so thick that the cardiovascular parameters, there's no vascularization, there's no perfusion of organs, etc. So we have to give about 40 to 50 liters of fluid to try to bring this volemia back to normal, okay? So 10% dehydration on a horse that weighs this much. The horse has about 10% of his weight is more or less in blood, but when he is dehydrated, this fluid that used to be in the blood is going to be also helping to go to the GI tract and continue to dehydrate. So when we talk about a 10% dehydration, we're talking about 40 to 50 liters of IV fluids to try to rehydrate this horse. Decreased peripheral perfusion, I already talked about because the blood is too thick, not happening. Very severe, unrelating pain. Horse is sweating a lot. The heart rate is super, super high. Okay. Respiratory rate is also going to be high. More ischemia, more necrosis, poor prognosis. Prognosis is the horse how the horse is going to respond to this particular colic. Pedunculated lipoma. We already talked about this. How being overweight is something. Ponies, for some reason, are very predisposed to having this. Older horses predisposed to having this. And this is just photos of, this is the lipoma and how it loops around and how this is very red, very inflamed, okay? But you can see how this is totally necrosated. It's dark, it's necrosated, and the barrier, the intestinal barrier is already lost here. All the bacteria that was in here gains access to the blood circulation and becomes a problem. This is just a schematic of how the lipoma can actually go around. This is multiple lipomas. If you guys can see, this is actually a photo, okay? So when the veterinarian goes there, he may remove this, he has to remove this, cut this whole loop out, but he needs to also see if he can find other lipomas to be able to remove them as well, okay? Intussusception, we already talked about this, is the telescoping of a piece of intestine into another one. It generally happens because this area is moving faster than this one, so it just goes and telescopes on itself. Like I said, it's a change in motility. There's different reasons that may happen, but there's just a big sausage in that area that needs to be removed because, as you can think about, as it telescopes in itself, the whole circulation in that area is cut off, okay? So you need to stabilize the horse and needs to correct that defect surgically. So you can see here the sausage that I'm talking about. It just telescopes on itself. Okay, guys, this is it for colic. Now I need you to pay attention because I have posted a PDF about endotoxemia, and I need you guys to read that. And I'm going to send you an email also before you watch the video because it's a very, very complicated disease. And I don't have a PowerPoint for that. I'm going to be drawing a lot, and I'm going to need you guys to know what I'm talking about before I start to draw. Okay? Sounds good? Hope you have a good weekend. Bye, guys.